Thanks for joining us. The One Big Beautiful Bill Act that was signed by President Donald Trump last summer includes nearly $1 trillion in cuts to federal health care spending over the next decade, impacting Medicare and Medicaid. Now, rural hospitals could be hit hardest since many older and lower income patients rely on those programs. KY3's Connor Trett spoke with rural hospitals in Missouri and Arkansas about how they're adjusting to these cuts.
In our smaller communities, specifically here in Aurora, we are more reliant on the Medicare and Medicaid programs because many of the rural residents have income challenges and/or are the aged.
More than half the patients seen at Mercy Hospital Aurora are on Medicare or Medicaid. For every procedure or visit by those patients, the hospital gets partially reimbursed at around 80%, according to the Missouri Hospital Association. The Eureka Springs Hospital is in a unique position since it's only one of 44 hospitals in the U.S. designated as a rural emergency hospital. Now, they get fully reimbursed on their Medicare and Medicaid expenses plus 5%. But where they're going to see the biggest changes is in the new work requirements in order to qualify for Medicaid.
When those Medicare, Medicaid recipients lose it, and then they have an emergency, and they don't have any insurance.
And for hospitals that aren't receiving that guaranteed money, they may feel extra financial strain due to the new Medicaid work requirements.
We have some folks who have been covered under Medicaid that will no longer be eligible. So that becomes uncompensated care to the rural hospitals. Then in turn, more uncompensated care means we're challenged to continue to provide all services.
Rural hospitals have been evaluating how they can best continue to serve their communities while operating on a tighter budget.
So we evaluate what services does the community need, which ones can we provide sustainably, what services are we providing today that we can no longer provide sustainably. So that evaluation of services that we provide, how we provide them, is a constant.
I went and researched what a hybrid ER/urgent care would be able to do for our community. What that does is if you're not feeling great and you have a lower level sickness, you don't have to worry about paying an emergency room price. We're going to reduce that cost to an urgent care price for you, so it makes it more affordable for you and that you can stay close to home when you're just not feeling well.
Connor Trett, KY3 News.